you got to treat the obesity, but they won't pay for the GLP-1s. No, that's off limits. You got to treat their depression, but you can't find a psychologist or a psychiatrist to see them because they just can't afford to see them for what Medicaid pays. And your options are to give them a little book to say, write down what was good about your day and come back in a week, and here's your Lexapro prescription. So it's key to have the resources to be able to do the work.
Well, and that's one of the things that I focus on when I give these talks, when I talk to folks about behavioral health integration. It's not one size fits all. We've been building this program for many years. And one thing I like to do is talk about our journey and how we got here. It's absolutely different in practices that have more Medicaid. And there are folks out there that we all know who are doing it in 5% Medicaid practices. Dr. Diasio in North Carolina is doing a lot of behavioral health integration. He and I have spoken on panels before. Dr. Gino in Cincinnati is doing it in a practice that has a lot more Medicaid than my practice. And what they do is they leverage the ability to get grants to fund some of their program, partner with local universities and training programs to provide services to kids. So you don't have to do it the same way we do it in our practice. And we started at the end as far as where we are now. I'm married to a therapist, LCSW.
That makes life easier.
No, no.
I'm sure she has a lot of friends that she can bring into work.
That's exactly right, George. What happened for us is we started our behavioral health integration by having her on she was a school counselor. And on the days that she wasn't at the school, she would do consultations for us. And there is a code that, and I'll share a link with you that you can put into the show notes, that folks can find a lot of resources that I have been sharing over the years. So she would meet with families, she would do some screening tests. And so one way to pay for some of this is all the extra 96127s and 96110s that you get from the PHQ-9s and the GAD-7s. And give families a curated list, right? Here are some therapists in our community that may have openings that I think would be a good fit for you, that have the right expertise. And it was way better than when I would give a list of 10 random names or refer them to a local program. That's how we started. That was our first step toward behavioral health integration. During the pandemic, she said, hey, my good friend Teresa, who's a school counselor at another local school, is looking to shift. And so we met and we said, I think you've got the knowledge and the experience to help us build what we're envisioning. And so while we hire you, and we hired one therapist who came on, and that was huge because not only was she able to continue doing the consultation and referral work, but she started providing some direct therapy. Took about 2 weeks and her schedule was totally overwhelmed, right? And we knew that we were going to have to shift to a different way of providing this care. But the point is, we had been doing a little bit at a time. At the same time, we found a local child psychiatrist and said, hey, can we hire you a couple of sessions a month to connect over lunch by Zoom? And we'll just present cases. And this is prior to our state having a statewide child psychiatry access programs. The advantage to us, we started our consultation session before that was available in California, but we were able to hear each other's cases. We were able to learn from her assessment of what we were seeing and what we were presenting. And so we increased our ability to keep those kids and to provide better care for them in our practice. One of the things when you bring up Medicaid and AAP, I think AAP is doing a lot of work with Medicaid right now, and certainly other folks who criticize them for not doing other stuff while they work on Medicaid reimbursement. We have to remember that behavioral health integration and our practices are a system, and there are plenty of things in your practice that don't necessarily pay for themselves and increase your ability to take care of your patients and see more kids. And so being able to have these kids get much better mental health care with the therapist and the child psychiatrist in my practice frees me up to see more checkups and give more vaccines and see more acute care. And You have to look at it as a system.